Okay, so like I said, my name's Russell. This is Graham. It's an honor to be online with you today. We are a couple of the managers, operators of Staff Relief Healthcare Services. We're going to take you through a little bit about our organization at the start, and if you have some questions, please jump on in. So our company has been around for over 25 years. We're family-owned and operated organization. We service right now exclusively Ontario, as west as Sarnia, Windsor area, all the way out east to the Ottawa region. Our goal is to provide awesome healthcare and support to a wide group of different types of clients in the community. We have a very diverse set of team members. Right now, it says over 400. It's even closer to 600 these days. These are individuals who are, a part of our organization for quite a long time. Um, the company is, like I said, we're a family-run organization. So our main goal is to provide excellent service, and we do so with respect, compassion, integrity as our core values. Our goal is to ensure that we create real relationships with family members and clients of ours that we're here to support, and that trickles down into our team members and the type of support and care that they bring forward. We didn't put it here on our slide, but we were actually just recently also given accreditation through Accreditation Canada, which is it was quite an undertaking for our organization to take on, and it was a really great learning experience, but something for us to be proud of that sort of shows these values as forefront of our organization, a company that believes in constant growth and improvement. So that's sort of a great new thing for us going into the year of 2025. Um, this is us. It's a sort of small focus on us. We have a few more team members that we didn't capture here in this picture, but that's us on a team outing. We try and do a couple of these fun outings over the course of the year with our office staff, just to keep everyone happy. But we have a pretty typical org chart. You met Graham and myself, Robert, our other operator and family member, Oleg, our director of healthcare, who helps to oversee client care plans, client intakes, ongoing education and training with our team members. We have our scheduling, our client care team, which helps to oversee and manage all of our schedules with our clients, communication with our team members, and just ensuring that everything is very, very smooth. Graham, as you met here, helps to oversee a lot of the operations, both on the client side and the staff side, with anyone that typically would like to work with Staff Relief. On a client side, you would probably speak with Graham, and he'd help ensure that you're well taken care of. And our human resource team head up by someone named Jyoti, who helps us to recruit amazing A players in the industry, which we'll get into a little bit more as well. So our caregivers, our staff, we like to call them, they're pretty diverse set of skills. We have PSWs, which are your typical personal support workers. They'll help with a lot of our families in home to deliver care, companionship, homemaking, different things like that. We have nurses on our team, registered nurses, RPNs, registered practical nurses. They are supporting us, our clients, maybe on a little bit more of the clinical things that come up. They obviously have a much more specific set of skills, and from time to time you might see them in the home setting where if a client requires nursing intervention, our nurses are able to do so. We're proud of who we are, and we're proud of our team, and I think this is a real reason why they tend to stick with us. Something that I think keeps us up all night is thinking about how we can help our clients, but even more so how we can help our staff. They're the backbone of what we do, and we try and pay it forward to them as much as we can. Our retention, our continuity amongst our team members, our tenure is it's pretty awesome. We have people that have been working with us for well over 10 years even in their current role with us. So that goes to show, they really feel that this is a safe place for them to work, and something that the accreditation process actually uncovered, in discussion with our staff. We do offer everyone health and dental benefits that is paid for by the organization. This is just something to ensure that we keep team members taken care of. Staff relief, I think, an important thing for us to, if we take anything away from this piece slide here, is just our 24/7 support. So our client care team is operating round the clock. We have someone that is available via phone or email. 365 days a year. The office doesn't sleep. The reason why is because things come up. There are emergencies, there are scheduling changes, there are intakes that come in. We want to make sure that one of us is available for you, and for our staff as well, on an emergency basis, right? Talked about our services. This is a cool map for you that kind of captures it a little bit more. I would say that we are present in almost all major cities across Ontario. The more rural we get, we have fewer staff members in those areas. That being said, there isn't anywhere we can't go, and anywhere we aren't. But again, as you can see, probably starting with the GTA, Ottawa, the Durham region. These are probably some of our most dense populations in terms of staff that we have in our organization. That said a little bit about who we are. I hope we covered most of it. I didn't want to take too much time on the introduction of our organization because I wanted to send it over to Graham, who is going to talk about why we're here today, which is home care tips. So if you do have any questions about our organization, like I said, you could throw them in the chat or write them down and we can discuss that a little bit more. But thank you for listening. Over to you.
Thank you. Thanks, Russ. So thanks everyone for coming. As Russ mentioned, if you were to call staff relief and want to discuss home care in your private home care in your own home, chances are you'd get Russ or myself or Robert. So we want to take the opportunity to proactively share with you some tips about arranging home care, because it's good to know maybe before you get to that point and you may be ill prepared. So always the phone call would normally start with me or Russ asking, are you getting subsidized care from the government? And always start there, because it's free and you've paid taxes your whole life. So you might as well utilize some of this home care that comes subsidized from the government. Right. If you've been in healthcare or if you've been through this with a loved one, it used to be called the CCAC. It then changed its name to the LIN. It then changed its name to Home and Community Care and Supports. And most recently, the government has just renamed the home care program as Ontario Health at Home. So why it's important to utilize the Ontario Health at Home or the subsidized supports is it ensures that you don't have to pay HST on private healthcare such as our services or someone else. So basically, it's the government's way of saying if you're eligible to get home care at home, then you shouldn't have to pay tax on the care that you augment with privately. And it's good to be in that system. So Ontario Health at Home system is integrated with long-term care facilities. If conditions grow worse, then you're part of that system. So it's always good to be part of it. So now to tips for an in-home assessment. So the government will come to your home and do an assessment. So some tips for that would be to ensure that you have someone present with your loved one, specifically if a loved one with memory impairment. Oftentimes they're there for a short period of time with a clipboard. They're going to ask some questions. And if your loved one says they take care of themselves and they bathe themselves and they don't need any help, then they won't get any help. So it is important for someone to advocate for your loved one to make sure that they're conveying the correct message to the government. Also, may not want to bring up that you need laundry done and sweeping done and vacuuming done, because the government isn't going to pick, they're not going to send their caregivers to do that. They're going to send their caregivers only with respect to personal care. So try to leave those little things out. And reiterate to your loved one, don't worry, mom, don't worry, dad, don't worry. This is a free service, so enjoy it. So now some tips for engaging, let's say, with a private home care company such as ourselves. Start slow, right? You don't have to set up, weeks of care or every day of care. We've noticed in our industry, a lot of families that we've had long time relationships with, we used to just go once a week for 4 hours to give the primary caregiver time to go to the bank, get some groceries, and they didn't have to rush. And then it would turn into 2 days a week and then more. But you start slow and baby steps. Um, Oftentimes, our clients don't feel themselves that they need the help. So that's where you need to, a tip would be to deflect that service somewhat and say, listen, Dad, we know you don't need the care, but Russ and I really feel we would feel a lot better if you had a little bit of care. It just kind of makes it so that your loved one doesn't feel like they're a burden. Or you can get creative. It's holiday season. You can say, we didn't know what to get you this year, so we got someone to come into the house once a week for December. I've already paid for it, so you better accept it, right? People, specifically seniors, they know if something's been purchased or already bought, that they're less apt to refuse it. Always emphasize that things are temporary, like with our service, there's no commitments, contracts, you can change it, cancel at any time. We realize healthcare, things change quickly, and we want to change quickly with you and adapt, but nothing's forever. And be honest about your loved one to the service provider. If your loved one didn't like bald men, then tell us so we don't show up to do the care. If they don't like men, if they respond better to ladies, right? Just be honest. We understand that no one is perfect in this world. We all have different quirks, and it's better to be upfront with them than a caregiver find out at the front door. Emotional awareness. So not recognize that our caregivers are trained, they're vetted, they're background checked, they're TB, excuse me, tested, flu shots. But as good as we are and as much as we care, we are never going to be the same to your loved one as you are. Okay, we can try, but they're never going to do things exactly the same way as you. We can try our best, but as much as we try, it can be hard. We're professionals at what we do. This is a professional service, so it's not so much a social or a family member. So we often say, if you need to get a hold of this PSW, please call us and we will get a hold of them, right? You don't really necessarily want to start sharing personal cell phones and that kind of thing with the team, because after they leave your loved one, they're going to see someone else's loved one. And we want their full attention to be on whatever client they're with at any given time. Um, so it's never really good to engage caregivers outside of scheduled support, because they're our team and they do this for a job. And if they're working for us, we want to make sure we're paying them to work. Otherwise, it's harder to keep them. If you're comfortable, the client's comfortable. So if you're very nervous about having that caregiver come in the first time, that's going to be reflected in your loved one's reaction to them as well. Oftentimes, a good PSW will walk in their first visit like they've been there already 100 times, because they know that their comfort level will dictate the client's comfort level. Try to mirror that and just, hey, how's it going, Russ? Welcome back. And things will run a little bit more smoothly. And then one thing is good to stress too is, if you want to share anything about your loved one with the caregiver, it's best to do so with some privacy, not in front of them and say, oh, I want to tell you about Russ's incontinence, or I want to tell you about Graham's, habits. These aren't things that you want to necessarily speak in front of that client. That you have to preserve that dignity. So there's some emotional tips. It's Canada. Physical preparation. One question I always ask when we write a care plan is, what entrance does your loved one want us to use? Not everyone uses the front door anymore. They like to go in through the garage. So whatever it is, let's be mindful that if we say we're going to send a caregiver at 10 a.m., they'll be there. And if they don't happen to show up, it's likelihood because you didn't tell us what door to knock on or where to enter or what buzzer to buzz. Um, don't share your keys and don't have keys cut for caregivers, and don't share your PIN codes to doors. These are, these are things that definitely the keys. I find there's a stopgap solution could be just hanging a key on like a realtor does for open houses. That could be an option if someone isn't able to open the door when the team arrives. Pets can lessen the chance of securing care. It's something to be prepared for. If you've got a real ring, what we found in 20 plus years in the industry is caregivers tend to love people first, and they can be less passionate about pets. Some love them, but again, when we talked about being upfront from the beginning, if there is a pet, let us know upfront so we can clear it with the team before they show up. Um, Valuable items secured in again 20 years. I would say 99% of the time, items that are misplaced, they are not stolen or removed from the home. It's when with cognitive impairment, and it can come an element of hoarding, and there can be some forgetfulness with where you place items. Our job as caregivers is to typically put things back the way we found them because there might be rhyme or reason why they're there. But if you have priceless family heirlooms, and if you're starting to see multiple people coming in that house, including government workers, it's a good idea to secure valuables. Um, Assistive devices, are they functioning? We have a lot of clients that might use mechanical lifts. Is that battery plugged in? Is their throw rugs off the floor? Those is the walker's brakes working on the rollator walker? Those little things are good to make sure are functioning prior to a care company coming in. Um, does your loved one have a landline telephone or their own cell phone? So what a lot of families will ask us, Graham, I want to call the caregiver after the shift to see how it went. Well, after the shift, that caregiver is probably going to see someone else, or if it's their end of work day, it should be their end of work day. If you want an update on your loved one, phone while you know we're in the house. So you can phone the landline of the home and get an update, phone the client's cell phone and say, can I speak to your caregiver? But honestly, we shouldn't be sharing our personal cell phones with clients because it can get abused. Check for snow, make sure you cleared the snow. We're caregivers, we're not shovelers. Sometimes we do have to shovel to get into homes, but all due respect, our passion is people and not shoveling to get in. Before we come, have a quick peek through that fridge, see what's outdated. Oftentimes our job is to prepare a light meal. And if there's items in the fridge that are all expired, it makes it harder for us to do so. And then another quick physical tip is label your garbage cans and your recycling, right? Oftentimes it could be part of our plan is to put them out on the curb or pick them up. But a lot of times we can end up bringing the neighbors' garbage cans and recycling back home with us too. So it's always good to have them labeled. So care preparation. So we're there to do care as our primary role. I mean, we can also help cook and we can do some cleaning and we can do some laundry. We are a private company. But if we've been asked to come and help someone with a shower, it's good to know that there's clean clothes available and towels. Um, personal care, keep in mind that personal care like a shower or a bath, specifically with someone with cognitive impairment, we may not have success the very first visit. We have to learn the client, they have to get to know and trust us. We'll do the best job that we can, but oftentimes we have to learn what approach is going to be best for that client and how they might respond. Our team is well trained, and we've just learned how to ask questions differently. Would you like to have your shower before breakfast or after breakfast? The goal is a shower, right? We'll give choice, but we also know how to ask questions that we can get the service done. We can help and assist with medications, but they should really be in a blister pack, and that's good rule of thumb for all of us, right? To know if we've taken those pills or if we haven't, to ensure that we don't take them twice. Um, and it's good to know for care preparations, PSWs in Ontario can assist with medication, but we can't administer medication. So we can help and pop pills out and say, here's your breakfast pills to take, but we couldn't necessarily crush those pills, put them in applesauce, and feed them to your loved one, which would be administering. Are there PRN medications available or utilized? So PRN are medicines that are as necessary or required. Um, a lot of folks can get anxiety with new people in the house, so maybe it would be good to have one of their anti-anxiety pills a half an hour before the caregiver arrives. Um, do they have frequent headaches? Tylenol. So are there medications that can help in the delivery of care? It's good to also note that foot care and cutting toenails is not necessarily a PSW's responsibility. A lot of families ask that question. I wanted to put in this presentation because it's seniors' feet, and specifically foot care, if done wrong, can be very detrimental to the client. So that's something a foot care nurse would be secured for. Don't hover over the client as the family member. Allow the caregiver to try to build their own rapport, because it can be embarrassing to be watched, right? So we see this a lot with spouses. They can hover, they get worried about their loved one, but it can be very embarrassing with your wife of 40 years watching you get prepared for a shower. Report challenges to the company to solve. Uh, excuse me, some personalities just might not match, right? It doesn't make them a bad caregiver. Our team does not get in trouble for that. It's okay to say, they don't seem to just be hitting it off. And all of us respond differently to different people. So we don't mind trying again. We don't mind sending a different person, but you just have to be honest and you have to share that with us. Um, be aware of kind of the baseline behavior and abilities of your loved ones. So you know what is out of source. Oftentimes, acute changes with your loved one are related to some sort of infection or something that's treatable. A lot of people say, my dad's just really gone downhill this week. I think it's time I get him care. And we asked the question, has he had his urine tested? Could he have a urinary tract infection? Could he have any other type of infection? Could he be sick, have pneumonia? So if you see an acute change with your loved one, chances are there's good reason for that. So that's how to prepare for some care. So some cost saving tips. It can get costly. Hourly care can run in the $30 an hour range in Ontario as a rule. But some cost saving tips were where we started. First, get your access to government care. That saves 13% off every bill. Could consider other options for statutory holidays. So our team are employees of staff relief. We're proud to pay them time and a half on Christmas Day and Boxing Day. So if you've got a lot of family present on those 2 days, you can trim down the cost by utilizing family and friends for holidays if you can get away with it. There's something like a lifeline that your loved one can wear and press the button in case they needed help or they had a fall. If your loved one's not prone to wander outdoors at night, then that lifeline, renting a lifeline per month can be a lot more cost effective than hiring a person to be there 12 hours to watch your loved one sleep overnight, right? So oftentimes I'll work with families to say, hey, we can leave at 11 at night, when they're asleep, and we can come back again at 7 in the morning, and that saves you significant amount of money on a daily basis. Um, Utilize supports on weekdays or weekends only. So some families will say, I'm starting to feel a bit burnt out. Well, perfect. Why don't you just book us on Fridays, Saturdays, and Sundays so you can reclaim your weekends again, fill your tank, get some rest, and then go back to being a helping as a caregiver throughout the week. Or we can just go all week long, and then when you know your loved ones are around on weekends or you're not at work, then cut us loose and save a little bit of money. So those are a couple different cost saving tips. And another one would be just to check and see if you have any private insurance coverage. So many of us have somehow signed up for long-term care disability kind of coverage, and we don't even know we have it. So explore. Um, as Russ mentioned, we do a lot of work in the Durham region, which is where GM is located. And a lot of those GM employees have Green Shield coverage for in-home support for $100,000 a year, which equates to, over 8 hours of care a day, 7 days a week. So see if you've got any insurance. We basically work with every major insurance provider, and we can bill directly. Would be ideal for our clients, but oftentimes you can pay up front and get reimbursed.
Mhm.
So those are some cost saving tips when it comes to preparing for caregivers in your home. Um, and it's you never want to think about it, but I even had this conversation this morning, is that you should have a plan B, right? We're just people, we're just caring people. Um, can your loved one report to us, our company, or to you if a caregiver doesn't arrive? So a conversation I had with a family member today was they have a nonverbal loved one, um, and they want 24-hour a day care because they want to go back to work, which is great. We happen to have a mechanism. If our caregiver doesn't arrive at 7 a.m., our team are alerted, our coordinating team, and we will find that person. However, you have to have a plan B. It's specifically if your loved one can't report that someone didn't show up. We're driving around in cars in the winter months, summer months, and things can happen just like they can every day to the rest of us. Who is the point of contact? So what I often tell families that have many children, large families, we just need one point of contact that can then spread that message to the rest of the family. Um, it can be things can fall through the cracks if we've got 4 different kids, 4 different phone numbers, 4 different emails to inform. We need to make sure that we can get a hold of one person, and if we can't reach them, who do we continue to try to reach, right? Um, think about if there's day programs in your area, which can be cost effective as well. And as opposed to one-on-one care. Do you have work from home options? And be flexible with caregiver of choice. So we're in healthcare, which means that we can tend to be around people that can be sick. So we too can get sick. We can call clients and say, sorry, Russ is feeling sick today. Can we send Graham in his stead? That's completely up to you. But having that flexibility it helps to ensure that you get the care that you so deserve.
Can I add one more here?
Please.
I think, let's say you're not using private support. Maybe you use someone through the Ontario Health at Home, through the government, or your loved one is managing some care on their own, or you're supporting a little bit with a loved one or a family member supporting a little bit. Another plan B to have is to have maybe already pre-vetted support, a private support system like Staff Relief Healthcare or another organization after following all of Graham's prompts of how to review and what to plan for. But that is part of your plan B as well, is having a backup option for a loved one in the case that there is a crisis. Maybe there is a snowstorm and you can't get to your loved ones, but a provider can get a staff member out there for a day, for an afternoon. Maybe, you go down sick or work gets really busy or the condition of a loved one drastically changes and we don't feel able nor willing to provide support. So you reach out to a service provider and a team that can help you navigate even through an early transition as you're figuring some other things out. And I think that's a lot of what this slide is all about, is planning in advance, which is something when we're dealing with, loved ones at home and thinking about how do we support them and how do we help them and how do we plan, we don't ask ourselves, the emergencies, because it's in our nature to probably, sweep those under the rug and deal with them when they come up. But things do happen. We see it all the time. I mean, we've been around, quite a while around the block, many, many times, and there are situations that unfold, and I'm sure in our own lives that you've seen that we don't plan for. So I think also having all of this to, that Graham mentioned is so important. And I think the overall theme is to think one step ahead, whether or not you pull on that lever and access that plan B is, I guess it's up to the circumstance, but to have those things in place so you are prepared when something happens, it will save you a lot of stress, a lot of time, and maybe even some money when, sometimes when we're the most desperate, people tend to take the most advantage of us.
Yeah.
So that's just one more thing to add.
I think it's a great point. And keeping in mind, like would you trust a company if you called them at 4 o'clock on a Friday and said, I need someone to sleep over at my mom's house tonight?
Right.
I mean, we can pivot that quickly. However, we do need someone's consent to start a file. So we're in healthcare to have access to someone's personal healthcare. We just need your consent. So it's hard to get that consent at Friday night at 4 o'clock if you're in a crisis mode. But if you are proactive, gab with us for 20 minutes and let us start a file for you and just keep it. Then it's a really good point, Russ. I didn't think of that, to be honest with you.
Yeah, no, it's okay. I mean, to the last point here on this slide, and under our philosophy of healthcare doesn't rest, if you called us at 10 p.m. on a Friday night, we'll be there for you. We have things in place, processes in place in our own organization to be able to support families in times of need at no extra cost to you. There is no extra cost for overnight hours, weekend hours, crisis hours, last minute hours. Like our job is to help you help your loved one, and that means many different things for many different people. But I think to plan in advance and think about what your options look like as you're thinking about your loved one situation is really important. And we didn't get into how to hire a home care agency. We've done presentations like that in the past, but I would make sure that when you're vetting teams and you're looking at who you would trust in your mom or dad's home or a loved one's home is to ensure that there isn't commitment, because I think the health and the well-being of someone is not something that you can commit to. What I mean by that is your plan B doesn't have you committing to certain amount of shifts or certain amount of days. It's a team behind you that will be there in the case you need and will be out when you don't need it anymore. And there's no strings attached. That's really important. And I mean, that I could spiral that into the philosophy of care quickly, which is the people we are, in our organization, the kind of care that we look for out of our team members is exactly that. It's respect and it's compassion. It's understanding the person, their needs, of who they are as an individual. And that helps us to create a care plan and execute a care plan that really means something to them. And it goes a long way. And we talked a lot about today about preparing and having things in place so that care is smooth and care is easy. But in the end of the day, care is delivered by people, and these people will have to think on their toes. And when they think about your loved one first and foremost, if that's their priority, no matter what the challenges, even if you didn't have clean towels available, I'm sure they'll figure something out
Mhm.
because the integrity of your loved one matters to them, and that's how it works. We have to always improve, and keeping our team members on their toes and to us matters a lot. So yeah, it's a little bit about us, guys. We'll uh, we'll come back to this sort of.
You'll have to forgive us. I think Russ and I are two individuals who spend majority of our day talking with people.
Yes.
But this we never talk at people, so you'll have to forgive us.
We may not be the best presenters.
We love back and forth,
Yeah.
so yeah, so just bear with us as we talk at you all this time. But feel free if you have any specific questions, pop them in the chat, and or it's kind of nice. No one's going to know what you asked or who asked it, and we're happy to just to give you some honest feedback about what to expect having caregivers in your home.
Yeah.
If you have any specific questions, shoot.
Thank you so much. It was very, very helpful. If we go back at the beginning when you talked about the tips to like the Christmas gift idea,
Mhm.
that I think that was really, really good. Do you have any other tips for people who would be maybe more close-minded to having a caregiver coming in?
I think, like again, I think what's most successful is try to deflect it. Don't make it about the patient, make it about yourself, right? We know that your loved one that has memory impairment loves you, and if you can make it so this service is going to help them, then chances are they'll begrudgingly accept it, right? And you could just say, me and my brother, we worry so much about you. Can you just accept this? For just 2 week trial, and that's and after that we don't ask you to entertain it ever again. And chances are by that 2 weeks is over, the client and that caregiver have built such a good rapport that they want them to come back. They look forward to them coming back.
Yeah,
It's just
good idea.
getting over that initial hurdle.
Thank
That's
you.
a good question, Fred. And something that we know we're challenged with even with our own family members, right?
Yeah.
I think people don't want to spend their money, or they think it's a waste of money. They don't want to bother time. They don't want people to be coming into their home. And you have all of these objections that you have to handle when trying to convince a loved one to agree to having some support. I think, that gentle, persuasive approach is always helpful and supportive. And Graham's right. I mean, if you make it more about you than about them, they may understand that a little bit more. The idea of introducing somebody is, I think it's the best option if you can get them to agree to just meet someone. They may not think they're all that bad, and maybe the care plan, which is to really execute a lot of hands-on care, maybe you gradually get there. Maybe the first week is just companionship. It's, play some cards, or watch a movie
Look through
together.
pictures, tell me about your vacations, right? Just try to get to know.
Have some tea and cookies, and to just kind of
Baby
develop
steps.
baby steps, as opposed to, like, sometimes we try and get somebody in the door to do everything. A loved one doesn't want to take a shower, be given a shower by a stranger, not unless they've had caregivers doing this with them for quite a long time. If you haven't ever had that before, and now all of a sudden you're being thrown into that reality, I mean, ask yourself, how would you feel? My guess is you wouldn't really like it. Like, and that's the truth. And I think it's that candid approach towards it. So, we know that even giving somebody with some cognitive impairment, it takes a while for them to actually accept a shower from you. And there may be even times that once they've already trusted you, that their behavior might trigger down the road, and they all of a sudden they don't want you to touch them. So slow baby steps. Even though you might be feeling stressed and anxious and ready for them to just get this help already, remember that if you force it and push it, it likely will backfire. So baby steps.
Which is to say, try not to come at home care from a place of crisis. And Russ and I see it every day. we quote someone for 4 hours a day, for service. They don't take it, and then they call us a month later, and they need 12-hour night overnight care now because someone's fallen and the whole
Mm-hmm.
situation's changed. So there's a question there. Do we do any work for clients to retain their cognitive functions? So I can kind of speak to the first one, and I'm going to let Russ run with the second one because you've got most experience with the second question.
Sure.
But I mean, one thing to note is that, I mean, the term dementia, as defined, is the inability to learn new tasks, right? So if that's the definition of it. So we're never you're never really going to improve from wherever state you're at right now. So what we would focus with that retention is, is to talk about memories that are really firm and intact. So, those are some of the ones that you really remember and you want to keep addressing them, right? However, like word searches, and they have proven to be helpful. And if you wanted us to have something like that integrated into the care plan, that after breakfast we do our word puzzles together and we try to stay cognitively challenged like that,
Yeah.
we would, and it would be in the care plan. I mean, other care plans will have things about mom loved vacationing. So let's look at all those old pictures, and she can't tell us if she had breakfast, but she can tell us all about her trip to Portugal in 1958, right? So these are things that we're going to want to try to encourage and foster, right? And then the second question, Dad doesn't speak any English. He only speaks a dialect of Mandarin. I would love to hear your knowledge about available services in Mandarin. So, I mean, if you were to call me today, I'll let Russ run with it. I would say we get these types of questions all the time about very specific traits or characteristics of our care team. To be fair, what we focus on first and foremost is, do they have the appropriate schooling? Do they have the appropriate training through us? Do they have a criminal background check within the last 6 months? Do they have a TB test? So these are all the items that we feel we have to tick those boxes in order to work with a caregiver.
Right.
Okay. And then I'll let you kind of address the specific Mandarin speaking.
Yeah, I mean, listen, this two-part question is a really good question because they actually feed into each other. Because having somebody that speaks the language of a client is likely a way to help keep their cognitive functions intact, right? If somebody only speaks Mandarin, but their caregiver only speaks French, well, the connection they have is going to be that of, I guess, eye contact, touch, whatever it is. There's not a lot of understanding. That actually can create more frustration. That can fog the mind up. Like it's not ideal. So I know why you're asking that, and to just elaborate off what Graham said first and foremost of cognitive function. If that's the main focus of what we want to execute in a care plan, that's what we would develop. Our director of care would stop and they would understand the needs of the client and create a plan that we can execute that's really focused on how we can maintain the sharpness of somebody, if at all possible. That could be outside of all of the other care, but these are things that are really important, and our caregivers are well equipped and trained to do so. Some are better than others. In terms of language, we do have Mandarin speaking in our company. The magic wand that we wave, it has glitches sometimes, and the glitches based on the ability for us to come through or not. And that usually is the area that we're servicing, and what types of team members we have in that area. So if you have a loved one who is looking for help here in the GTA, and Mandarin is a really a big important thing on that wish list, on that need to have list that you have, my response is absolutely. If you're calling me for someone out in Sarnia Mandarin, I'll tell you right now, we know our teams really well. We have over 600 staff, but I can tell you I don't have a Mandarin speaker in Sarnia. That doesn't mean that we can't lean on our resources and leverage our network and speak to our team and find out what's available in an area. But I think when you're reaching out for support and care for a loved one,
Yeah.
whether it be with our organization or any other organization, these are things that you should bring forward. If Mandarin speaking is going to make a world of a difference for a loved one, that should be front and center. Whether or not an organization can help you, well, I hope they'll be honest with you and transparent in what they can do.
Yeah.
But those are things that are really important.
And
So
keep in mind too, I mean, I've been a PSW myself since 2001.
Yeah.
And I've had to serve many different types of clients, some with severe strokes, so they were nonverbal, some that palliative care, so they were no longer able to even open their eyes, right? Us PSWs are really trained to take that holistic approach with clients, right? So we may not speak Mandarin, but we can tell if you have to pee, and we can tell, if you're hungry or hot or cold or irritated.
Right.
So these are other things that just come with it. And remember, I said in the beginning, we are not you and we're not family, but we are professionals, right? And if that's a glitch for you, then be proactive and have a plan B, and maybe have an app on your phone so we can converse, at least to get the basic knowledge down, or go and do the work ahead of time and say, here's 10 most commonly used words in the house, and this is what they mean. And maybe they can point at something like, we can work creatively as a team. But we do get it, right? I need an Italian-speaking caregiver or bust. And 20 years ago, European caregivers from European descent were a lot more plentiful, but times have changed and there's less of certain demographics in certain positions, right?
It's a really good question.
It was.
I'm sure you have a lot of experience with people with Alzheimer's. What do you do when the person doesn't remember the caregiver each time they come in? It's like going back to zero every time.
It's a great question, and again, like I only, my love was caring for folks with Alzheimer's, right? And it's oftentimes, yes, they're not going to remember us. That's the nature of the disease, right? But we remember them, right? And so the trick to providing home care to someone with, let's say, advanced Alzheimer's, latter stage Alzheimer's disease, is continuity of care. Is so you have either 7 days a week coverage, you're going to get Graham, or you're going to get Russ, one of us, right? And we get to know clients so well that when we walk in the door, like we own the place and we know everything about you because we do, that client responds like, hey, wait a minute, maybe Russ does know me, right? Oftentimes in a care plan, I'll say, this has been arranged by the son, Robert. So name drop Robert. So a caregiver comes, hi, how are you, Mr. Smith? Robert sent me. I'm friends with Robert. It was nice to speak with Robert. So those are ways that you can quickly gain back that trust. So they kind of say, hey, wait a minute, this person is legit, right? And so, but if your loved one's resistive to care and they're going to tell us to turn us away at the door, that is something that we should work through, right? In that first visit or second visit, maybe family should be present to let us in the door. But we're creative,
Something like Alzheimer's for us is a sort of a clinical diagnosis that we would only want to send specific team members to a client like that. So we have staff who are well trained and have a lot of experience in working with clients, patients that have Alzheimer's. As similarly, we have a team of people that support palliative care, end of life type of care. We have people who support Parkinson's, and that is a place where they have a lot of experience. They even have a passion, and they've taken advanced learning and education within a scope of work like that. So that's how we would approach it. I know the question is, they don't know you. We know them every day, but they're not going to remember the caregiver every day. But by ensuring that our team, Graham, we use the word continuity, I would say that's a given. We'll do things on our end as well, which is ensure that we're not sharing those team members with any other of our clients, because we want them to be available. We want them to be prepared. If a staff member goes down and gets sick and we have to send in now a new person who has little exposure to Alzheimer's and they come into that client, there's a chance it's a terrible day. So by us ensuring certain things, even on an administrative office level, it can actually create a way better client experience in the care level down, in the home. So those are some ways how we might approach
and it
it.
ties back to that honesty, being honest right from the get-go, right? If you know that your uncle likes ladies and he might smack one of them, on the bottom, then tell us that, because we're going to send in a caregiver that will say, excuse me, not appropriate, right?
Yeah.
A new
And
grad,
it happens.
yeah, like a new grad PSW that is just starting out in their career is not going to have that life skill or fortitude to be able to do that.
Correct.
But also some people with dementia are not going to respond to an older caregiver. But if we send in someone younger, they almost treat them like a grandkid or a child and say, oh, thanks, you can help me. I don't mind taking help from you, right? So the honesty right out of the gate is the only way to do this, because that way we can really fine tune some searches.
Well said.
And do you have like a meeting with the family first? Like
Yeah,
to talk about this?
Exactly. The intake is, it depends how urgent a need is, right? But let's say we're dealing with a case where it's not super urgent. Family wants to do some learning, find out what they can accomplish with, let's say, a service like ours. And we would approach it like this. One of us would take a phone call, probably Graham, would do an intake, get to know the needs, get to know I would say the basic of it is where they're located, what kind of hours they need, what kind of services they might be using. And I would say a general idea of the scope of work. If all of that kind of checks out and, Graham is able to deliver an honest, transparent plan in place and it looks like a good fit and the family's happy, we'll move you over to the director of care, who will now work on establishing a care plan, which is the clinical side of things. So with the information he receives, he can now set up a system in place to ensure that our caregivers are when they show up to work, they have a full understanding of how to execute care. We'll use that care plan that we develop, though, through that more comprehensive discussion to handpick the individuals who will support that loved one. That would be sort of the basic. In terms of ongoing support and changing care plans, that's for us is what our service is all about, is to be partners in delivering care and service, to give a family a team behind them of professionals who are there for them, as changes may come up, right?
I mean, one client comes to mind that on the care plan, it even says that we make an egg for the dog Jim at breakfast time every morning, right? So dog eats an egg a day, believe it or not. So those are in depth as they can get. And it's just all about the information that we're given, right? And we're adults, like adult learning is different. So just because we wrote down a care plan, we also go one step further. We talk to each caregiver before they go in the house to say, did you read the care plan? Okay, here, this is some triggers, right? Do you understand that? Do you understand this? Do you understand they are redirected better by this? But nothing's perfect. When we tend to set up home care, it's very high touch between us the first 2 weeks, I would say, right? Questions that you forgot to ask or we didn't know, so, but then after it gets into a rhythm, then you forget me and you forget Russ, because that caregiver just takes over and is so important in everyone's life, right?
It's a good question.